that other people can come from you are all well and I appreciate you. I hope my volume is up, my sound is up. Somebody attest to that. Sound up. Sound is okay. Let me know if my sound is out. Everyone, decay after night. Thanks for joining. Tika, thanks for joining. After and anyways, thank you for joining. Please do not forget to give the video a thumbs up. I'm seeing 9 people watching already. One thumbs up. So please let's carry thumbs up to match the number of people that are watching. Like, just with a couple of minutes to build our audience so that other people can join us. Yes. Also give the video a thumbs up. My audio sound is not clear. How is it clear? Now my sound is not clear. I can't do it. And what about now? I'm off the fan. Are you hearing me now? Is the sound okay? The fan was on, so I'm off the fan. Let the sound is okay. Are you getting me? Are you getting me now? Caroline, are you getting me? Good evening, my inbox. Welcome. Sound okay. If I hold my mic like this, it's better. It's better now. So maybe I all good evening, all I'm pushing. Thanks for joining. Okay. Helena said, yes, I can hear now. Okay, then I think I'm going to go with my like this. So that then we can hear. In case the volume is not okay, please always indicate so that we can switch. Thank you very much. And now, are you hearing me now? Are you hearing me now? Let's try without mic. Try without the mic. Joining from Paris. Say Caroline all the way from Paris. Nice. Okay, let's do it without the mic. What about now? Let me put this. Okay, the line. I think it's a network problem. If the line is breaking, then it has to. And now, is it better? Are you getting it now? Yeah, it's a pity. I'll try my possible best to see that the net internet speed, but I cannot see more than I can, but I will try. The line is breaking. I can hear it, but it's a pity. Okay, Jideka, it's good now because now I'm not using the mic, so is it better without the mic? If it's better without the mic, then I go on still shaking. How are we going to still shake? Sarah says it's good. Okay, thank you very much, Sarah, for that confirmation. It's better now. Okay, if it's better now, then maybe we go without the mic. So I'll just go without the mic. Maybe the mic is also using sound quality. So I will do without the mic. I hope you all can get me better. Rita says it's better. Oh, I'm glad it's better. I'm glad it's going better. I hope it stays like this, because today is going to be a wonderful, special day. You all know we are going to have a special guest also. It better stays well. Sounds still good. It's better. Okay. Rita says it's better. So if it's better, I think we just proceed like this. In case the sound goes bad, please always indicate so that we can do something better. Sound good. Is it okay? If it's okay, I think we are going to start at 12 over 8 p.m. and 12 over that time. So we'll just go directly into our today. Like you all have seen from uh, thumbnail, today we are going to be talking about erectile dysfunction and low. This is actually a common problem that is by men go out. So today we are going to discuss how we can tackle it. Not tackling it with men, but tackling it with our African foods, because we have good African food, we have nutrient facts that can help us to against it. So I hope my volume is okay. I hope you all are getting. So you are all welcome. You all know my name is Rachel. I'm Rabicono. I'm the food and I'm your African diabetes educator online. You are all welcome. Like I said, today we are going to talk about something very important, something very serious in our community, and that is something that is very important and something that is affecting many people, especially people that are suffering with diabetes, which means that not only people with diabetes are suffering with erectile dysfunction or low, but we also have normal people that are suffering. And I want to believe that most of you that are there are people that have sisters with diabetes or they are having diabetes. That is why you are all. Maybe there are also people that are here that don't have any of these conditions. Want to just learn about erectile dysfunction and know how we can better it. We are all in the right. And there is one thing I want to make clear also that we have to understand. We have to understand that when it comes to erectile dysfunction is not only about man. No, you don't have to make it only about man. You don't have to make it that it's a private thing that affects only man. This time you have to make it like a health issue. It is a health problem. It is a problem that is affecting the man and his relationship. For those who are married, it can be a problem that is affecting their marriages also. So today we need to discuss all that. Sometimes it's not only the people discuss their sexual lives. Maybe this can the volume okay. Are you still getting me? Instead of confirmation, are you all getting it is not only about sexual life, but also can affect them mentally. So today we are going to be talking about that because it's something that is serious and if we don't take control over it, it can destroy a man's life and also destroy a man's family. So today we we are going to see how we are going to tackle it. We are not going to talk anything about medication here. No, we are not going to talk about how you can treat erectile dysfunction or low medication. We are also going to discuss how you can treat it naturally. And when I talk about natural, I mean how we can treat it using our African food stuff, because our African food stuff are very nutritive, contain the nutrients that we need in order to better this problem as erectile dysfunction. Yeah, my students are my I see you. You're welcome. Getting me. Please, you people should send message. Somebody should confirm the message. I'm not seeing your message. And give the video a thumbs up. Like the video. Please like the video. Is the volume okay? There's noise. Okay, the noise is gone. Jideka, I understand. Noise is Jideka, thank you very much for that observation. But the noise is gone now. So are you getting it clearly? I hope all are getting it. The noise is gone now, right? Can somebody confirm if the noise is gone, if everything is good? Let's my comment section. Can somebody type something? Okay, Njeka, thank you very much for that confirmation. So everything is going on well. So just continue. Okay, Karen, thank you very much. I'm happy you are here and you all are. So, like I was saying, we are going to talk about erectile dysfunction, and we are not going to talk about how to treat erectile dysfunction using medications, but we are going to focus on African food. African food definitely contain some of the nutrients that are used in treating or managing erectile dysfunction. If not, they can also improve erectile dysfunction. So, like you all have a special guest with us tonight, and I will not introduce her. I will allow her to come when it's her time to come up and she will introduce herself. Normally, she is a specialist about sexual life, about sexual anything that has to do with sexual intercourse. She is actually a specialist. She knows the techniques, she knows how to what to do, how to do it. So I will not talk about that. I will allow her to come and introduce herself and she will tell us all what we can do. But also she is a YouTuber. And please, I'm begging of you all to go and subscribe to her channel. Support her because she has wonderful content. Go to her channel, support her, subscribe to her channel, share her channel. If anyone is having problem with their marriage, their relationship because of sexual intercourse, please share those videos to them and make sure to subscribe to our channel. Follow us so that you can correct updates for the videos that she will be making. These videos are going to help in as much as sex life is concerned. I will talk about that. But for that, please share this video. Subscribe to the channel if you haven't yet subscribed. Send it to somebody that you think it might be useful to them because it is normally a useful content that we are going to discuss and share and invite a friend so that they can all change their minds. With that being said, let's just go. I'll start with the introduction to erectile dysfunction. When we talk about erectile dysfunction, what in simple terms and in the most easiest is that erectile dysfunction just means that a man cannot keep an erection. So a man is unable to have an erection or to keep this erection sexual intercourse. In simple, that is what is as erectile dysfunction. They are having problem with erection. Then when we talk about low libido simply means that you have a low sexual desire, and of course, low libido also happens. So low libido is something that is contributing to women are also struggling when you don't have anxiety to have sex with partners or your husband or any person you are in. So that is what is as you have desire. Always, oh, you don't feel that. That is ego making you force to get that desire, to get that anxiety to have sexual intercourse with your partner. And we talk about erectile dysfunction. I said erectile dysfunction is a man cannot have or keep an erection with sexual intercourse. That is and it is happening. If we are talking about erectile dysfunction and I'm connecting it to diabetes, it means that there is actually link to erectile dysfunction and diabetes. How are these two elements? I will explain it also simple things that we all can say. Hey, I see you here. Thanks for joining. Hey, Pastor Elias, thanks for joining. I see you, Pastor Elias. Please, if you haven't yet subscribed to the channel, make sure to subscribe, like, and share the video so that other people can join. So now, what is the connection between diabetes and erectile dysfunction? We know that when you have diabetes, it means that blood levels are sugar levels are high. You know, the sugar level in the blood is very high. So that is why you have diabetes. And because the sugar levels are very this sugar tends to cut into your blood vessels, which will cause your blood vessels to get narrow. And if your blood vessels are narrow, it means that the blood flow that is into or out of your blood vessels is slower because the blood vessels are narrow. So the entrance is narrow, just time that. Take for example, if you have a tap, if you have a tap or a pipe, just use a pipe. You have a pipe and then debt fill this pipe. See that if debt fill this pipe, it means that water that is going to this pipe will not reach the pipe because you have too much debt in the pipe and you have blocked the entrance to this pipe. That is the same thing when it comes to erectile dysfunction or when it comes to diabetes and erectile dysfunction because of high blood sugar level. And remember, when you have high blood sugar level, your blood becomes thicker. Your blood becomes thicker because of the sugar that is found. So when this blood or this sugar tends to clot around the cell walls of the blood vessels, it makes the passage very narrow and difficult to see. And if blood is not flowing directly into the blood vessels, it means that nerves can be damaged. Nerves can be damaged, also can damage, and that is why you see people that are having erectile dysfunction, they are having problems. Their nerves have been damaged or their blood vessels have been damaged all because of the high blood sugar that is found in them. So that is the connection between erectile dysfunction and diabetes. And the honest truth is that over 50% of people, men, I'm talking now about over 50% of men that are having diabetes, most of them, percentage of 50 and above, they are having erectile dysfunction because their blood sugar level is under control. So if your blood sugar level are under control, are going to likely resist erectile dysfunction. That's what we are going to discuss. We are going to see how we can talk about it so that it can help us to best situation we can best situation actually. So far, so who have understood all what I have said in the comment section, just confirm in the comment section that the definition of erectile dysfunction, low libido, and connection between erectile dysfunction and diabetes procedure. So before we proceed, please just confirm that the explanation or the definition of both libido, erectile dysfunction, and connection between diabetes and erectile dysfunction was clear. I can proceed. Can somebody say something in the comment section? Let me go. Is it that you are not getting? I don't know. Is it that you, my volume, you are not getting me? But I don't know why you are not responding. Is it that you don't hear me? What should I repeat, Caroline? What do you want me to repeat? Giving, giving the blessing, breaking. Oh, that is not. Caroline, what do you want me to repeat again? Let me know. What do you want me to? Is it better now leaving the blessing? Okay, she says it's now. Okay, I hope it just stays like. So was my explanation clear? Is a connection between erectile dysfunction and diabetes clear? Let me know before we proceed. I have the mark. Try my network is better now. Like network mark. One second, please. Let me try to check the network. Let me try to check. Okay, next. Let me try to see if I can. Let me try to see if I can. Hi. Okay, is the voice okay? Is it still breaking? The volume is okay. Is my voice still breaking? Voice still breaking? Please, can someone confirm if the voice still breaking? If my voice is breaking, I think I will just stop here and then I'll invite our guest so that she can come up and talk. Maybe her network is better so we can all profit from her. I actually did the introduction. I just wanted us to know the relationship between erectile dysfunction, what erectile dysfunction is all about, what low libido means, and the connection between erectile dysfunction and diabetes. And I have explained the connection between erectile dysfunction and diabetes. I said most people, about 50% of men who are having diabetes, are likely to have erectile dysfunction because of damaged blood vessels. So I will allow our guest to come up so I will bring her up so that she can talk to us and tell us. Okay, she says it's better now. Okay, thank you very much. So I will just allow our nurse because I have done the introduction. I will just call on our nurse to come on. Maybe her network will be much better than my own so that she can talk to us about the various ways that we can treat erectile dysfunction in our African system. So, nurse, blessing, if you are there, please can you turn on the microphone so that people can see you and then you have the and you can talk to us.
Good evening, everyone. Can you hear me?
Yes, I can hear you. I don't know about the other.
Let's wait for them if they can hear me. Let's confirm from them because we are here because of them. I hope my network is not breaking. Okay. All right. Iya Misodi, Caroline, thank you for confirming. Welcome to the live, everyone. Welcome. Just as she has said, we'll just dive in quickly. Just as she has said about the definition of erectile dysfunction. Is when a man is unable to achieve an erection and maintain it to the point that he wants to use it. That is just the simple term. And I know diabetes is not just related to men alone. So libido is also affected when you have diabetes. And that is why you as a lady, you should be here as well because we are talking both for female and for male. So it's not just for men. The word erectile dysfunction is not just for men because we as ladies, we've got other sexual organs in our body like the clitoris, which needs to erect as well for us to enjoy sexual intercourse. So that is why we are here today. First thing first, I'm just going to say this. For a man to achieve a proper erection, like a proper one, in order to make his or a partner happy, there's need for blood flow to the sexual organ. Now, sexual organs could be penis, could be the vagina, could be other body parts, but the most important thing is the blood flow. And that is why diabetes come in. We all know that what happened with diabetes is that the blood sugar is high. That is where diabetes problem. That's just the simple way with diabetes. And when the blood sugar is high, it affects a lot of things in the body. Most especially when it comes to diabetes is the nerves and the blood vessels. And these are the two important things that is important for you to achieve an erection. If you can hear me, please can you list the two things that is important for a man to achieve an erection? Please list it in the comment section. I want to know if you are understanding what I'm saying.
Don't forget to
Sorry?
don't forget to introduce yourself.
Ah, okay, I will. Nerves and blood vessels. Yes, thank you, Marvel. Thank you so much. Okay, I forgot that aspect. My name is Blessing Solomon, but the name of my channel is Blessing on Demand, and I focus more on sexual health, both adults, male, teenagers, anything sexual health, and you know anything at all, health generally. I do health just like her, but she's more focused on diabetes and focused on sexual health and other parts of the body. So that's me. You are all welcome. It's so nice to meet you all.
Continue. So she said, Blessing on Demand. So her YouTube channel, Blessing on Demand, and she talks everything about sexual health. So please make sure to check her channel out, Blessing on Demand, because she's teaching about sexual health so that you can subscribe to her channel, support her. She's one. I said I should also learn from her. I'll also try to pin her YouTube channel link on the uh, comment link so that you can go and subscribe to her channel. Thank you. Thank you, sir.
All right, okay, thank you, Mama. So thank you very much, Marvel G, Injideka, and Adobe. Thank you, everyone, for the response. You are all correct. So, like I said, the most important thing is blood supply, but because of the diabetes, this is what the diabetes, the high blood sugar, this is what it affects. And we all know that the two things or the most important things that we do or we recommend as health practitioner is that you should maintain your diet, eat balanced diet, the one that will not affect your blood sugar, and medication as well, and also exercise and other things. That is the advice you'll be given at the hospital. So in today's life, we are going to be talking about food, and we're also going to be talking about other aspects that you can use to achieve a proper erection, like a good sexual lifestyle. That is what we are talking more on today. So I think in Africa we consume more of carbohydrates, more of swallow. If it's not swallow, then we don't enjoy it. And part of you people, it's not just you. If it's not swallow, we don't enjoy it. And also in this, century or this current world, a lot of things that we ingest, we don't even know the source, we don't know what it is made up, and we don't know what or how exactly it affects our body. So that is why it is important for you to watch what you eat and what you put into your tummy, because it's going to affect a lot of things. Imagine you have diabetes now and then it's going to affect your erection. What is the relationship? Is it not from one problem to another? So we'll talk about food first before we move to other aspects. Now, there are some foods that naturally they have all these natural nutrients that benefit our body, but we overlook them. We are like, this one can't be. One of the most important thing that you should, add to your diet as someone who has diabetes and want to maintain their erection or like their sexual health is locust beans. You see, locust beans, most people don't know that it has this, flavor and spice that it adds to food. Natural, it is natural, not the one that is baptized with salt, don't get me wrong. I mean the natural one. So instead of using too much, spices like all these what is it called, like maggi and salt and all of that, instead of putting so much of it in your food, your soup, you can add natural stuff like locust beans, like I said, because this will actually help to improve your blood flow. And remember, without proper blood flow, it is impossible. Not the word impossible, because there's no way that your penis can erect. This is because for you to have an erection, there's a process to it. There's a rush of blood that needs to go to a particular place in your penis. I don't need to mention the name, but just for your information, it is called corpus cavernosum. This place is where the blood is going to fill up before you achieve an erection. But it becomes a problem when the blood supply to that place is blocked. That is when you want John Thomas to rise, but it will not rise, and then you disappoint your lady. It is not your fault. It is because it is a normal thing, it's a physiological thing that's supposed to happen, but it's not happening because of one underlying condition, which is what? Diabetes, and that is what we are talking about today. So another important fruit that you should introduce or that you should eat if you are not eating it is watermelon. There's something called nitric oxide. Now, let's put the nitric oxide somewhere. Before the nitric oxide, if you chop watermelon, is more or less like water. Yes, it is colorful, it has seeds, it has this pink or reddish thing in it that makes it look like it's sweeter. Yes, some of it is sweet and some of them lack taste, but most of it is sweet. It is natural sweetness, it is not artificial. And this is good because it contains nitric oxide. And this nitric oxide is one of those things that help the blood vessels to remain open, not to be closed. So if you have diabetes now, you can add it to your meal. Let's say, I always tell people portion control is important. It's not what you eat, oh, sometimes portion control. You want to eat, let's say fufu, and then you already have this big bowl of fufu, and then you have big bowl of watermelon one side. After your fufu, you now go to your watermelon. You are eating wrongly. You're supposed to finish your vegetables first, and then you now mount it with your swallow, because if you eat your swallow first, you're going to make sure that you are full first before you go to your vegetables, and then you are adding the vegetables to it. But when you eat the vegetables, you're just going to eat a little amount of the swallow. If you can hear me, can you list the two important things that I have listed in when it comes to food? Those two things that I have listed: fruits and a particular spice that you can add to your soup, to your rice, and whatnot that I have mentioned. Latoye Jackson. I have an Asian eyes. Oh, I'm hearing it for the first time. Is it me or diabetic mindful talk mama? West African.
We are not seeing you.
Sorry?
We are not seeing you.
You're not what?
We are not seeing you on camera.
You're not seeing me.
No.
Are you joking?
Yeah, I thought you knew about it.
My camera is on. What do I do? Can you see me now?
No.
It's on. I can see myself actually.
Maybe you told me because we are not seeing you. That I don't know. Maybe some people can see it. I don't know.
So what are you seeing?
I'm seeing it. It's just divided, and the other side is just black.
If you can see me, can you type it in the comment section, please?
Ballad.
Latoya Jackson can see me. Caroline, you can't see me?
I thought you knew it.
Njideka, thank you for confirming. I can see myself. I don't know what else to do now.
If you can see her, please confirm so she know how to adjust the camera. I don't know how to adjust the camera. I don't know.
Hey, you can't see me. Should I rejoin? What should I do?
Maybe you can rejoin. Just go back and then you come again. Let's see how.
Okay, with the link, right?
Yes, I guess.
Okay, okay. Almost.
Yeah, Miss Odi say I can't see her. Okay, no problem. She will go and she will come back. There we can see. We can see you. Why are you keeping us like that? We can see you.
I'm sorry. I'm so sorry. I thought you can see me.
No, finally we can see you. Oh, thank you very much. Then you're welcome. Now that
Thank
can
you.
see you properly, you're welcome.
Adobia, you can still see me.
We're not seeing.
Thank you, Caroline. Thank you. Okay, you all can see me now. Okay, so I can see before I left that some of you listed the name, which is locust beans and watermelon. So I think I've already said that of watermelon. The other ones you can actually
Please, can I break you short?
yeah, sure.
Okay, because it may be, you are getting well, because it may be a little bit confusing to people if they hear you advising them now to take watermelon. Because we all know that watermelon has a very high glycemic index for people who are managing that. It's one of the foods that we normally don't recommend them because of their high blood sugar level. It's going to
Yeah.
spike their blood sugar level. But talking about erectile dysfunction, it is very important that you eat watermelon. But then, just like she said, you have to take portion of your portion. So portion control is very important. Another thing that you can do is if you want to eat your watermelon, combine your watermelon with your meals, just like she said. Don't eat your watermelon on an empty stomach because if you eat your watermelon on an empty stomach, it's definitely going to spike your blood sugar level.
Yeah.
And then another thing that you can also do is if you want to eat watermelon, combine this watermelon with protein and healthy fat. You can add it like maybe granite, you can add it like maybe yogurt, you can add something like egg so that it can help to slow down how your sugar is going to spike up. And finally, what you can also do or what you must not do, never take watermelon to make juice out of or to make a smoothie out of it. That is a no because you are going to destroy all the nutrients, especially the fiber that is found in this watermelon. And when you destroy this fiber, it's going to spike up your blood sugar level very fast. So portion of that, she has talked about watermelon, and watermelon is very good because it contains what is known as citrulline, and citrulline is going to help with the nitric oxide in it. It's going to help to relax your blood vessels, and when the blood vessels are relaxed, and then this blood flow can quickly go to your veins, and then you can get your erection. So I said I should bring out this clarification about watermelon so that you don't get confused. The diabetes doc said you don't have to eat
Yeah.
watermelon and not take it. You have to clarify that you can eat it, but portion control and combine it with your food and
Mm.
body levels to five. Thank you very much.
Okay. Just as she has said, she just explained how you can have it as a diabetic person. So yes, please listen to her. She knows you all better than me. One thing you should know is that because of your condition, let's say because of the diabetic mellitus, you have more than three times higher chances of developing erectile dysfunction than any other man. And this is because of the high sugar that can affect your nerves. It can also affect your what's it called, the blood vessels. And remember what I said about your erection. Proper blood flow is needed at all times. And most men these days, they don't even have the early erection that occurs in men. Most men, when they wake up, they have this early erection, but some people, because of lifestyle, because of other medical conditions like diabetes as well, they lack this exercise, this natural exercise that was being placed there. Some of them lack it already. So that is why you have to approach yours when it comes to food and other things that you can do. So the next thing that I can talk about, when it comes to food that you can ingest is what is it called? There are some food that has zinc, vitamins, and other. They combine all these things together. Those are your green leafy vegetables. Now, green leafy vegetables, note the word green, meaning the reason why we are focusing on these things is because they have a lot of nutrients in them. And this is because they are healthy for you to eat. And we have them in different, what's it called? Different types. You have the spinach, you have this, what is it called? Mama, can you help me with green leafy vegetables?
I leave to have bitter
Aha,
leaf,
bitter
we
leaf,
have
yes.
ogu, even our
Ugu, yes, that's true. Yes. So all
pumpkin
these
leaf.
yeah, pumpkin leaf, exactly. Before I go to the pumpkin seed as well. So pumpkin leaf, you add it to your green leafy vegetables. So maybe after this live, you can visit my channel. I've got like an erection salad.
I mean, so you can pick your link so that they can go to their channel, subscribe to their
Yes.
channel, and click your channel.
Mm.
I'm
That
moderator.
Yes, I made a video on erection salad, specifically on erection salad. But like my diabetic mindful mama talks said, rather, there are some things that you should eat in control, portion control. You should not eat it like the other people who don't have diabetes. But I think green leafy vegetables is something they can consume, right, Mama?
Yes,
Aha.
they
So,
don't have calories, no calories,
ahead,
no
ahead.
carbohydrates, just contain fiber and
Yes. Because I remember, even though I'm not a diabetic coach, but I remember when I was in nursing school, they do tell us that when you have diabetes, you should eat more vegetables and a small size of, your swallow any carbohydrate you want to. Kale leaves, thank you. Inji, deca, thank you. So those are the vegetables that are nice, and this is because they have zinc, they have vitamins, they have potassium, and loads more. Magnesium, yes. And the potassium is highly, highly important because aside from your blood sugar, you are also there's also a risk for you to have like what's it called, like hypertension, like all these things that has to do with your heart. And your heart and your penis, they are like two friends that cannot be separated. So forget the blood vessels passing blood to the penis. What if the main machine that is manufacturing the blood itself is faulty? So if that thing is faulty, there's no way it can produce blood for the blood vessels to even take to the, even if the blood vessel is healthy, it will not carry blood because the one that is supposed to provide it is not healthy. So that is why you need to, introduce food that can actually help you to manage, lots of these organs together and not just focusing on one. And also exercise. I mentioned this to everybody. You don't need to go to the gym. You don't need to run 10,000 miles or whatever. Walking alone is a good exercise for your heart. Walking, when you walk, you take a walk. It's not like you're going to this one, you're taking your car, you are going to this, you're taking. No, try to walk more and do some light exercise. There's something called Kegel exercise. This type of Kegel exercise actually help you with your pelvic floor muscles. It is not just food alone. There are some times that you achieve an erection, but you cannot maintain it. 1, 2, 3 minutes, you're finished. Don't do that. You are an escape 1 minute man. You can't do that to a lady or somebody you claim you love, because person will not be, they can't have what they want. That is when erectile dysfunction becomes a problem. So yes, Elvis Ejo, yes, it's good to go for work immediately after you work, and you don't have to wait till you eat as well. You can actually walk around anytime and whenever. So, like I was saying, that when you're unable to make your woman happy, it is a problem. And that is why you should do all things possible to ensure that you're intact, and not that it is when it is time for the activities, your John Thomas is not responding. It's not nice. Let's not do it like that. So that is why you should do some exercise as well. Also, stress management. Look, in fact, about 80% of men, they are so anxious about the size of their penis, about if they will be able to what's it called? This English is running away from me. If they will be able to satisfy, yes, if they will be able to satisfy their woman. But do you know that your fear, your anxiety alone is already affecting you? In the brain, ask diabetes talk mama, there's something called fight or flight mode. It's like you are seeing danger. Your brain will tell you to run. It will not focus on you having an erection at that point in time. It is for you to run. That is what you will be focusing. That is what your brain will be focusing on that time. And when it comes to sexual health, your mental health needs to be stable. You need to be present in the activities. So you cannot be like, oh, you want to do this, and then your mind is somewhere else. You are thinking, oh, will she like it? Is this enough for me to, make her to do this or make? No, don't do that. Try to focus on the activities and manage your stress, because stress is one of the factors, in fact, top factors that is affecting your sexual health. It's another thing for you to, achieve an erection, but to maintain it is another thing. But when you are under stress, it might even be impossible for you to achieve an erection, because that is the last thing your brain is thinking about at that point in time. So stress management can include you, still going for a walk, choose an hobby, get something else to do, have a chat, communicate with your partner. If you feel like there's something that maybe you are feeling like, oh, I have these rashes around my something, or a lot of anything at all, try to speak with your partner instead of hiding it, because when you lie one lie, you will lie another lie to cover it up, and that is when your mind is divided from the activity. So we need the name of your channel, ma. Sheep.
Just pin your channel name.
Elvis Ejo, choose your fruits wisely, like cucumber, avocado, celery. Avoid watermelon, mangoes, and sweet fruits. Yes, Elvis, you are right. Maybe you came late.
Yes, Elvis,
Diabetic.
can you put your channel
Mama, can you reply Elvis Ejo? This.
Elvis, we talked about that. Yes, of course, you have to avoid watermelon, mango, and sweet fruits because they have a high glycemic index. But
Mm,
before you came in, I don't know, maybe you're joining us now. Before you came in, talk about watermelon. Now, watermelon is very helpful when it comes to erectile dysfunction because watermelon contains what as citrulline, and citrulline is going to help with the nitric oxide. It's going to relax your muscles and it's going to help in the body. So you can eat watermelon. For that person that do have diabetes and are suffering with erectile dysfunction, you can eat the watermelon. But then eat watermelon
portion
that
control.
the watermelon can spike your sugar. So what you have to eat watermelon, combine your watermelon, add some salt, fat, and protein when you eat your watermelon. Also, do not let watermelon and make this
Mm-hmm.
out because you are going to destroy fiber that is going to slow down absorption of sugar. So, yes, I'm right. Cucumber, avocado, celery are very good. Watermelon, mangoes, and sweet fruits are not good for diabetic, but who are managing erectile dysfunction, who can have watermelon, they have
Elvis, do you understand now? I hope you understand now. So let's continue. When it comes to your, you managing diabetes and erectile dysfunction, you need to monitor your blood sugar level. I'm sure she must have, educate you on that, when and how to do it, and what to do when it is high or low. All these things, and face loads of health challenges. H. pylori. Oh, okay. So you need to monitor your blood sugar level. It is most important, because if you don't know when it is high, there's no way you will know that something is going on wrong. So make sure you do your checks up. Don't play with your check up. Make sure you do them regularly. And also, when you talk about your erectile dysfunction, it is important that you have a conversation, like, for your partner to understand you, because there are some things that you can actually do. There are some, there are some, not really exercise, but there are some things that you can introduce to your sexual life that can help you to maintain your erection, like the stop and go method. If you know that you are having, difficulty in maintaining your erection, or you are the type that suffers from premature ejaculation, you can do the stop and go method. But if your partner is not aware of all these things, it will be difficult for her to understand why you are stopping in the process of you guys having something going on. So that is why communication is important, because your partner is also involved in the relationship. There's no point hiding the, your condition or anything like that. I hope you all can understand what I'm saying. Please, if you can, type yes in the comment section.
if you understand please type in the comment section that it was clear so that she knows that she's not talking to herself or she's not making sense. So we know we are all on the same page. Okay, Evie says yes.
Yeah, okay. Elvis. Caroline, are you still here? NGK, thank you.
Caroline is there.
Okay. Okay, thank you, thank you. Also, there are some things that you need to avoid when it comes to you maintaining your sexual health. The basic ones is that you should stop smoking. If you smoke, either stop it or you reduce it if you can't. But there are so many programs out there that can help you with smoke cessation. There are so many programs out there if you know it's a problem. But smoking would destroy your sexual health, it will destroy your erection. And this is because it contains some chemicals. There are some things in smoking that affect the blood vessels, the process of stop and go. Evo Bekono. Okay, the process of stop and go is just, when you are in the middle of sexual activity with your partner and you feel the urge to want to ejaculate, you want to release. The stop and go method is you withdraw at that point in time, and then by yourself you stroke your penis up, down, up, down. This is just a way of distracting the ejaculation from coming. This is mostly used by people that have anxiety. You are the type that you're anxious, because anxiety also is one of those things that can make you to come quickly. So the stop and go method works best for people like that. I hope you understand it now. So, as I was saying about the smoking, smoking is not good. It's not just for the liver, it's also not good for the heart as well. Then, like I said, any
Also for the blood vessels. For the blood
exactly,
vessels.
exactly, anything that affects your heart is affecting most parts of your body, because these organs in our body, they are all connected somehow. Your heart is connected to your bladder, to your urine, to your kidney, to everything that you can think of. So smoking is not good for you, because once anything can thicken your blood vessel, there's a problem. Anything at all, be it cholesterol, be it atherosclerosis, be it any particles at all that is blocking the supply of blood to other organs in the body, it is not good. Those are the things that can affect you in all aspects actually. So smoking is not good for you. You need to reduce that. Dehydration, yes, dehydration can is not the right word for you. It's not definite. It may, because whether you drink or not, there's going to be blood supply, but the way it's supposed to flow will be affected. That is the thing. But dehydration will help your blood to flow better. So dehydration is one of those things that will affect erectile dysfunction if you continue to do it. But it is not like when you don't drink today, then you are having erectile dysfunction. No, it is when it becomes an habit for you not to drink. When you lack blood supply, that is when it can lead to erectile dysfunction. But it is not a definite thing that dehydration can lead to erectile dysfunction. But it can help you, because when you drink, you are promoting blood flow to other organs of the body, which the penis is not exempted. I hope you understand, Elvis. Also, alcohol. I know alcohol is one of those things you should avoid also when it comes to you managing diabetes. It is not just diabetes as well. Also, it affects your sexual health. So reduce your alcohol intake, because all these things can in one way or the other, it affects you either hormonal or anything that has to do with your blood vessels. All these things, they affect them, they make them ticking, they transform them from the way they are being created. And when there's an alteration, that is where there is problem. I hope you understand. I don't drink alcohol for 3 years now. That's good. Elvis, you are doing very well. I'm clapping for you.
Yes, keep it up. Elvis, you should keep it up.
Yes, please keep it up. um, yeah, okay. So please reduce or stop your alcohol intake if you can. Also, there are some things that you can do when it comes to your sexual health to keep yourself active. Remember when I said that you need to check things regularly? It is not just your blood sugar alone. Sometimes when you go into the hospital, ask them, please, can you check my hepatitis, something? Can you check my whatever? Let them check, collect your blood and do some tests for you to know what you are suffering from, because sometimes the underlying thing that might be causing you to have, erectile dysfunction might not even be something that is so big that is incurable. Sometimes it's just a small, what is it called, procedure, or one or two things that needs to be done for you to achieve your erection back. So this is why proper checkup, your bloods, visiting your gynecologist or sexologist, this is why it is important. Also, don't overuse your thing. It's good to do it, it's a good exercise, but don't overuse it. Don't go and meet one small girl that will make you to that will put you in 69 position in 6 minutes. Don't do that, because there are so many things that can, cause injuries to your penis, like penile fracture. And when you have penile fracture, it's a problem. There's no way you can even have erection after that one. There's no way. Because some people, I know a lot of people, especially where we come from, because of the shame, they will not come out, they will not want to talk that, oh, I injured myself. How will you explain that you injured yourself there? What is Elvis? I saw the magic of stopping alcohol with my knee pain. I discovered my knees got better when I stopped. That's a good one, Elvis. I think generally when you stop taking alcohol or smoking, there's a big difference in them, because when you take all these things, they also affect other parts of your body. Like I said, it's not just the heart or the other parts that we have been mentioning in this video. So, like I said, make sure you are taking proper care of your thing and not, just going here and there however you want it. So, all these things, they might not directly cause you to have erectile dysfunction, but it can affect your sexual health. And those are the things that can, lead to, it's not like they will actually cause erectile dysfunction directly, but from one place to another, anything that can shorten blood supply to your penis can cause that. If you have any penile fracture, you can injure any blood vessels without you knowing. In there, you just see that it's swollen, you will think that it's the size that is increasing. No, it's not the size that is increasing.
Welcome.
Sorry.
No, it's okay.
Okay, so also you should also avoid those things that can affect your hormone levels, because if you don't know, testosterone is one of those hormones that help you to be in the mood, that help you to, maintain your libido. Because when your testosterone is low, it's going to affect you negatively. So that is why you should avoid some things that can affect your hormone, because you don't even know which of them. We have the testosterone, estrogen, and other ones like that, but you don't know which one is going to affect which. So it is better you reduce or you stop those things that can affect it. Things like cheese, things like, you having, like women now, we understand that there are some things that it is unavoidable, like PCOS and all of that. It happen in our body, and then with management and everything we get better. But there are some things you can also avoid, like food. Those are the things that you can use to control yourself. These are the things that will help you to control your hormone level, and not just, taking medication all the time. Sometimes you might not even need medication. What you need is another approach. That is why they call it treatment and management. Treatment, you take the drug and manage it. If you take the drug and you are still doing what you are not supposed to do, it will not go, it will be there. Right, Mama?
Yes, that is it.
Uh-huh.
You have to manage it. You have to maintain it.
Yes. Yes. So that is why most times when they tell people you have hypertension, they will give them drug. And when they take the drug for 1 week, they say, ah,
You
Auntie,
can't
it's
do.
low now. Oh, can I stop the tablets? You can't stop. That is why they call it maintenance. They can either reduce the dosage. Mercy Arowobusoye. My husband started having dark spots under his armpit and now it's on his neck. What can we do? Is presently taking flex pen. What is flex pen?
I think it's an insulin.
Pen is talking about insulin.
Ah, okay.
Is your husband a diabetic, Mama Mercy? Mercy, is your Madam Mercy? Is your husband a diabetic?
Hi, Mr.
He
Nicholas.
might
You're
be
welcome.
having
Thanks for
allergy.
joining.
He might be having allergy.
Madam Mercy, is your husband
She's saying
Diabetic.
yes.
Okay, your husband is a diabetic. On this channel, we are talking about how you can manage and reverse diabetes using natural food. So you are in the right place. You can follow me. You can also send me a DM, send me an email for a one-on-one consultation so we can talk on how your husband can reverse and manage his diabetes naturally. But I have very educative videos on this channel that can help you also to manage your diabetes and reverse it. But if you want a personal conversation with me or you want a one-on-one talk so that I can assess your case and put you through, please send me an email on diabetesmindfultalks@gmail.com. Diabetesmindfultalk@gmail.com. Then I can talk to you and we see how we can work together according to your goals, because it depends on what you want to achieve. You have to have a goal. What do you want to achieve? If I know your goal, and then we can try to see how we can work to achieve that goal. Your contact, my contact, you can send me an email on diabetesmindfultalks@gmail.com. Yes, diabetesmindfultalks@gmail.com. Also, if you want a one-on-one consultation, please, you can send me an email so that we can book an appointment and I'll help you how to reverse diabetes. But if you are having issues with your sexual health, then you have to contact Blessing on Demand because she is a specialist on sexual health. I asked her to pin her channel here so that you can subscribe to her channel also and follow her. Follow her because she has very educative and inspiring videos on her platform to help you to reverse your erectile dysfunction or for women. She talks about PCOS so you can know how to balance your hormones. She is a specialist on that domain. So please subscribe to her channel, support her for more of this information. Nurse Blessing, I wanted to ask you a question because all throughout you have been talking is like it's mostly specific to the men. It's like the men they are feeling all this video is
I'm
direct.
about to talk about the women and
Voila.
libido and female genital mutilation, all of that. I'm about to bring that in now.
Okay, thank
And how
you.
to enjoy intercourse.
Voila,
I know my
thank you.
women.
Please, before you talk that, put your channel on the screen first, please.
I can't type. There's no option for me to type here.
Okay, let me see if I can go to your channel. I'll copy a link and I post it here so that people can subscribe to your channel, please.
Okay, okay. Can I continue?
You can continue, ma. Thank you.
Okay.
Thank
So
you.
yeah. So just as I was saying about the men, we've been talking about the men all along. So now let's mix both together, both male and female. Like I said from the beginning, we are going to be talking about both male and female, not just the men, because a lot of women as well they suffer from libido. I think I made a video sometimes on TikTok, and someone commented and said she's having problem with wanting to be in the mood, that she's always not wanting to be in the mood. Then when I went down deeply and asked her so many questions, I found out that you know it could be that the testosterone level was low, and also she had FGM done for her. Female genital mutilation was done for her. And most times, I think in the older generations, that is one of those things that they do without even, knowing the consequences that might come up in the future. So we'll first talk about the libido, the testosterone, and also we'll move to that other things like the female genital mutilation. So when it comes to you having a proper, what is it called, sexual health as a lady, number one thing is important. You need to be hygienic, like on point. Because if you're suffering from any infection, be it yeast, be it bacterial vaginosis, any infection at all, there's no way you can enjoy sexual intercourse, because with these infections that I have mentioned, your wetness will be affected. And that is what is needed, because if you are not wet, it's going to be full of pain, injuries, and next time psychologically your brain will be telling you run, no, run, no, run, no, because it's pain that is coming.
That's
Sorry.
right. That's right.
I'm being playful. So yes, you need to be wet, and that is why you need to be hygienic. Do not wear wet underwear. All these things, they are normal things, but most people don't know. You go out, you sweat, you just stay like that. No, you're supposed to change as a lady. That place should be dry unless it is a natural, secretions that is coming. It should not be, wet at any point in time. And most importantly, we need to change our underwears. If you can't change it every 3 months, make it an habit to change it every 6 months. Some women still have pants for 2 3 years, some people say 5 years, and they are proud of it to say, I've been bringing this pants from so so year. Please don't be one of them. So those are the things that you can do when it comes to infection like yeast. Now, other part of infection like bacterial vaginosis, like sexually transmitted infection, it is always important for you to protect yourself. Yes, I know it's your partner, it's your this, it's your that, but sometimes men as well can have infection due to them not cleaning up properly, or one or two things. So it is important you protect yourself. If you know that you're not ready for the consequences like sexually transmitted infection, like pregnancy, all these things, that is why you need to avoid them, so that you will not mess with your sexual health. Also, when it comes to your hormone, ladies, let's be careful with what we put on our face, on our body. Shilem, 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 you want to glow everywhere, you will glow, but make sure you read. Be sure of what you are putting on your body, because these days there are so many things that is being sold online for you to look good, for you to do this, but it's actually affecting your hormones. That is affecting your hormones, and when your hormones is being affected, it's going to affect a lot of things. You will see so many people today, they are fighting PCOS, same people they are fighting hyperprolactinemia and a lot of things. So that is why you need to be careful with what you apply on your body and what you eat as well. So when it comes to your hormone, there are two hormones that is very, very important. Your testosterone is important, and your estrogen, although you don't need testosterone like men, but you still need
There
it
are
as
just
well.
a small amount.
Yes, you need it in small amount. Men need it more than you, but you see that small amount. If you know they know they knew. Sorry, put in Yoruba. If you know they know,
Of course.
yes, there is not going to be, you're not going to be what you want. That thing you want, you're not going to achieve it. And most times, most women, they be like, oh, I already have continue, I have my children already. I don't want it again. You want it, oh, you need it. All this your pepper body that is making you to do like this is because you are not coming down to enjoy the natural thing that God blessed us with. So it is important for you to do it regularly, because sometimes there are so many things that, the advantages. There are some hormones that is being released in our body after these activities. I'm sure you know what I'm talking about. I don't need to mention it. Do you all understand what I mean? Caroline, Pastor Elias, Dor, Njide, can you understand me? Please type yes in the comment section if you can understand what I'm saying.
That is Nest
It's
Blessings.
a YouTube channel on the screen. Please, you can also subscribe. You can just click on the link, the blue link on the screen, and subscribe to her channel directly.
Marvel G, thank you. Thank you for confirming. Thank you, Caroline. Thank you. Thank you. Okay, so as I was saying, there are some hormones. Sarah, thank you. As I was saying, there are some hormones in our body that is being released after this good activity. And those hormones, they are also important for you to function in your day-to-day lifestyle, your day-to-day living. They are important. Hormones like all these happy hormones in our body, oxytocin, all these hormones, naturally, they will not come, but it is during these activities or after these activities that it comes into your body, it's being released. And that is why you see that sometimes when you finish the activity, all you just want to do is to relax, because at this point your brain, your body, everything is happy, joyful. So those are the things when it comes to your hormone. And before you get all this happy hormone, you need to do the things. Not that you tell your man, oh, today headache, tomorrow back pain, you'll be lying up and down. Please don't do that. Because all these things also, you know, I don't know, there's an adage that says that the more you move far away from something, the less you become familiar with it. So that is why when you engage in it, you'll be able to know where this one is good and where this one is not, which leads me to the next point. Women, let's learn to open our mouth. Communication, you have passed the age of where your mommy will tell you, don't say this one to this person, don't say that one to that person, your husband's house. Learn to open your mouth and talk to your man. Oh, this is what you are doing that I like. This is what you are doing that I don't like. So that when the time come that you will not be feeling left out when other women, you are having a discussion. It is because you and your partner, you're not talking, you're not exploring things together. So when it comes to your sexual health as a lady, you learn to be vocal. You need to learn to be vocal, to open your mouth and talk with, to explain what you want and what you don't want. I hope you understand that aspect. I hope you all understand that aspect that I just explained. Communication is key. It is very, very important. Okay, I'll just continue. Also, there are some things as well. There are some food that you can eat that can help you to increase your wetness. Yes, there are some food that, not food, but fruits and food together. We'll just combine it together that you can eat to help to maintain your what's it called, your wetness. So any food at all that contains zinc, all these vitamin, all these there's another one I'm forgetting the name. When I remember, I will list the name. But I know zinc and vitamin. It could be vitamin A, it could be B12, it could be C as well, vitamin C. Like all this orange, all this, even spinach as well. Spinach, I told you guys that it has a lot of vitamins. It's not just vitamin. Okra as well. See, Elvis, do you know the thing inside okra that is making all of you to say is good for wetness? Because what are they draw? Elvis, is that why you are saying that? Okay, I'm going to tell you, yes, okra is good. It is not because, yes, egusi is good because of its natural fat. Those fats is good, but when it becomes in excess, you already know that egusi has fat, so don't use too much oil to cook it when you want to cook it, because when you are using too much oil to cook it, it's like you are adding more fat to it. And most of this oil that we are using, especially palm oil, they're not supposed to consume it in large quantities. Some of them are unsaturated and they can block the blood vessels. And just like men as well, I hope you know that the lady's clitoris is like the penis as well. There's a space for it to have an erection. Yes, if you look at it with like all the way they check it with microscope, the diagram, if you check it, it looks similar to the penis. It also has a glance. That thing that is outside like this, it's a glance. It's like that of the men. And that is why during the activity, when you are in the mood, that is when that thing will point out very well. But people that have female genital mutilation, they don't have this pointing that we are talking about. They've already cut it off because they said, oh, they don't want them to be promiscuous. Little did they know that they are actually, they're actually not affect, they're actually making them not to like the intercourse because it's going to cause them pain. And that is why any man at all that is with such women should not approach it like the normal men that will just go straight and start touching. No, you will only make her to feel pain. Good news is that the clitoris is not just that thing you have seen like that. It's expand into the vagina. It's embedded inside the vagina. That is why you need to go systematically. Don't let us corrupt diabetes talk, mama. Come to my channel to come and learn
Because
better.
they need the information.
They need this information, so you can say it gives them. They need it.
Okay. So there's
But
a
mom, I would like you, because we've talked about the foods, we've talked about lifestyle. Maybe there are also some techniques that they can use for them to increase their blood flow or to improve this
yeah.
erectile problem of or libido. Maybe you can teach them about some techniques that they can also use that can help them also, or even to increase their desire, because yeah, it's very important.
Okay, that's where we are going. We are almost. That's why I'm going. Please go ahead. We need this part, that part. Okay. So as I was saying, as a man, you don't need to approach just like the normal woman who the what's it called, the clitoris has not been altered. So the one who the clitoris has been altered, you will go by side to side. There's something called side to side. It's just like in nursing. We have, you roll one person from this side, then you roll it back in order to change the cloth or the bed sheet. So this one now is you're going to touch the clitoris on the side of the vagina. You know, the vagina has two big lips, the labia majora and the labia minora. On the wall of it, that is where you will press gently. Or don't press as if you are pressing something hard, very gently. And when you do this, few minutes after, you will notice that she's wet already. That is when you can now approach that place that looks like the clitoris. But going directly to that place that looks like the clitoris is going to be painful. She's not going to enjoy it. And also, the clitoris is not the only erogenous place in a woman's body. E plenty die. You see breast, na one of them. You see the back of the hair, na one of them. Some women, in fact large amount of women, like when their neck is being played with, and other parts of the body. So what you need to do is to pay attention to your woman. Don't just jump straight into the activity, because if you do that, you're just going to she's just going to be like, oh yeah, come and do today one, let me go. No. Yes, don't let it be like that. That is why we call it intercourse. It is a two people business. You people need to come together to enjoy it. That when you do it in a proper way, you see that next time she won't be the one to come and call Daddy Lagbaja, come, I need to talk to you in the room. She's not talking. She wants more because she enjoyed the last one. So all these things, that is what you need to do. Also, men, if you know that you're fighting premature ejaculation, because sometimes some women will tell me, aunty nurse, me I know they do today, because before you know, 1 minute 2 minutes is done. No. If you know that, this is what you are fighting with, like I said, communication is important, because there are some things you will be doing that can make her to be like, what is this man doing again? But when she already knows that you are benefiting both of you, she will not even complain. In fact, she will help you, so that you people can do it together. Foreplay, don't skip foreplay. Some of our parents, we never see them kiss. Why? You people, you people should do foreplay. Kiss each other, touch each other in good places. Good places. I don't want to hear all these women that will be like, hey, me, I can't do this one now. You have to do everything. It's only when you are not comfortable with it, or your health is saying otherwise, that is when you should avoid it. But like you're just saying, I don't want to do this, you should not do it. You should try out new things, new techniques. And some women, the only thing they know is to remove wrapper and lie on the bed. Kilo day. Every time you go, they do that one, you don't know another one. Learn to do other ones, other styles, because sometimes men actually need fantasy. They need something that drives them crazy. They don't need you to be on the bed. These are the little things that you can do to maintain your sexual health, because sometimes you are not actually having a problem, but you are having problem because of the approach that you are using to do that in activity. Can that explanation you just give help vaginal tightness? Yes, let me tell you, there are some women that have, like vaginitis, which is an infection or inflammation of the vagina. It's in two ways. There are some people that it is because of infection, there are some people that it is because of what they are putting inside. Some people are putting alum because they want you to be tight. You are very, very, very wrong. If you put alum on your skin, just on your skin, you will see how tight and how this thing is going to be. That is exactly what you are doing to your vagina. And when your man puts his thing inside, that is where you have injury. You're not going to enjoy it, because you're making it tight, but the tightness is not natural. The wall is dry, it's not wet. So medical condition. There are some people that they have a medical condition that naturally it is tight. There are some surgeries that can be done. There are some, plastic surgeries that is being done just to widen the opening of the clitoris, the vagina, because we have different vagina. Mine is different from your own as a lady. Everybody own it. Some people have shallow, some people have deep, and that is why your man thing, you need to make it to your own size of the thing. That's why I tell most people sometimes, You don't say that maybe the woman, her thing is too wide. No, maybe it's your thing that is too small for her thing. She didn't create herself. It's not because she's promiscuous or she has slept with a lot of men. It's just the way she's being created. Elvis, men learn how to use a pillow under the answers you are wearing. Yeah, so I said it's not only to stay like this on the bed, learn to use other equipment. She can also stand as well. She can also use one side as well. So those are the things you can do. This vaginal tightness, if you know that it's not happening before and it's just happening, it is what you checking. You can go to your gynecologist. They are going to use an equipment called, what is that thing, mama, that they will insert to check the wall of the vagina?
No idea.
I've forgotten. There's an equipment that you can use to check the wall of the vagina to be sure there's no any swelling, because sometimes there could be swelling, a growth. Sometimes that could be causing this type of thing. Uh, speculum, yes, it's like they use it in where they are giving birth. What is that in maternity? That's where they use it. Yes.
Or D and C, like that when they are doing D and C.
Yes, dilatation and curettage. Yes, that's it. That's the thing. So they need to use that thing to check the wall of the vagina to be sure that there's no growth there. Because sometimes some people develop growths in the, we also have what's it called, ovarian cancer and all of that. This is, they need to check it. That is why going for your that's why I said regular checkup is important. And I'm sure women who are not up to 65 years, they know that they should go into the clinic to do, oh, why did I forget it? What is this thing that they will take sample from the, from the, hmm, I've forgotten. They need to, there's a place they take sample just at the entrance of the vagina to check if there's any growth, abnormal growth or anything like that. I've forgotten the name of the test. Anyways, I'll mention if I remember. Men learn how to use it. We call it angling. Yes, yes. You call it different names. Some people call it raising the bomb. It depends on you and your partner. You can choose to name it or you leave it like that. So for men as well, there are so many men that choose to like use foreign objects on their thing because they want it to be bigger or longer or this or that. You should not do that because this is the only thing you have. Just one. It's not like your finger where you have five. That is the only thing you have that make people call you a man. Apart from your power, that is the only. And when something is wrong with it, it takes so many procedures or a lot. That's if you, even if it is reversible. Sometimes most of them, yes, pap smears. Thank you, Njideka. That's it, pap smear. Yes, so you get your pap smear done to be sure that the growth there or the tissues there, they are normal, because sometimes that is the only way you can know that there's something. You can't see it in the physical until they take the sample. It's like a swab. They'll take it and take it to the laboratory to check it. So as I'm saying, some men, they use so many equipment. There's this vacuum that was just released some months ago. If you see the way men were rushing it on Amazon, and come and see, few days later, so many men were being brought into the ED. Some are stuck, some are swollen, and then the thing is in the middle. Avoid all these things because they can't help you. Nowadays, I know there are a lot of medications, a lot of equipment that people are selling that they think that will actually help you. Sometimes just make do of what you have and use it well. It's not by size, but how good you can use it. Let me tell you one secret. Women don't even like it bigger. It's a problem because when it is big, you need to learn the angles that you will use to enjoy it. Because if you have it big as a man and your lady is having a shallow vagina, it's pain. You are causing her pain because your thing is very longer than her own. Yes. Some women, they use ginger, garlic, cloves because they want their vagina to be tight. Some people have proven that it's working, but scientifically, which is what us in this generation we trust now, scientifically, it is unproven that these things can.
Evidence based.
Yes, yes, it is unproven that this type of things can actually help you. They can't. My sister, the secret is angry, not size. See, I said, no, see, that's why I told them it's not by size. And some men, they even have it big, they can't even use it. So that is why technique is very, very important. Don't go and be looking for all these things. Instead, just focus on maintaining the one you have, because when you approach it in terms of diet, you are having your normal early erection, all this morning erection, because those are the things that can actually help you to maintain your erection, and also the size as well, because sometimes men experience penis shrinkage. Yes, they do, because of one or two things. And some men, they wear some things that even make it unbreathable for the thing. They will be wearing tight
That
and
is right.
nylon.
It's very right.
Yes, very tight and nylon. See, let me tell you, those two things dangling under your thing, there's a reason God created it like that, to be dangling. They need to be outside. Hair needs to breathe to them, because they can't function well in a hot environment. So that is why you should maintain it. Wear loose boxers. Make sure that hairs are flowing in and out of it every time. Because if you are a man and you are fighting infertility, this could be one of the reasons that you might be having this type of condition. Because if you're always packing your scrotum, you are not letting the testicles, you are not letting them to breathe, it can affect the amount of sperm that is being produced. So let the thing breathe, please. And also, it's not only women that have infection, men also can have it. That is why you should clean it properly. Don't just shower and come out like that. No, wash it properly, like you are washing your body. Wash it and make sure that your glands, don't forget it is folded. Don't always forget it's folded. So make sure you raise it up, clean it well, and return it back. Or make sure you return it back to where you bring it from. Because when you don't wash it and you leave it long time like that, it can actually cause you to have infection as well. Note any sign at all, whether ulcer, whether swelling, anything, redness at all. It could be indicating something. LV, the bed is the worst place to have sex. The cushion chair, car is Elvis.
And there is a question here from
For you. Bekono
Okay.
Igbo says majority of our men don't have time for romance these days, especially in the West. Both sex are affected. So what is your advice on this?
I would say number one thing is intentionality. See, everything in this life, I was saying it that time, that unless you make something an habit, some people, maybe due to work related, or children, childcare or whatnot, maybe timing, let's just say there's no time. That is why I'm following Elvis with this, that you don't need to be in your bedroom. Sometimes you can meet up wherever. It could be that you're just closer to each other for some reason. You could get an apartment to enjoy yourself, put your children somewhere, put them to your parent, your neighbor, wherever. Just tell them, give me 2 hours or 1 hour. Have fun with your partner. And even when you're together, make sure that you're spending quality time together, because these days you will see husband and wife in on the bed, though they're on the phone, chan 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 chan, on the phone. Before you know, they want to give 30 minutes to intercourse. You don't do that. Romance starts from act of service. Yes, ladies especially, mentally you prepare them from morning. If you want to have intercourse in the night, it's not when you know that in the night, then in the evening, that's when they can't forget,
start
so they will
talking
still
about it.
remember. In the morning, when she's carrying this thing, you help her to carry it. You are coming from somewhere, even if it is small thing, just buy it to show her that, I remember you today. Or you call her, how are you
Start
doing?
cajoling her in from the morning.
Hmm,
Exactly. Just
hmm.
do things that will make her smile. Text her. You people should have it. You people started from somewhere. This is not how you ask her out, and this is not how you started the relationship. So
That's right.
intentionality, that is what I will always say, because I believe we human being, when we want something to happen, we make it happen. If you ask anybody now, will you just wake up and not go to work if you don't have money? You will go to work, because if you don't go to work, you cannot have money. So that is exactly what you need to do. You need to take it as a job, an hobby, something that needs to be done. Apart from this, I don't think there's anything. Some people lie that communication creates bond, but I don't think so. This activity is the most important. That is why they even call it what? Something something in marriage. It is one of those things that sealed marriage. So if this is not in the marriage, then what is left in the relationship? So it is something that you need to do with intention, something that you need to say in your mind, oh, this needs to happen. And sometimes some women, they are the one making their partner not even to be in the mood. You have been in the house all day, you are tying wrapper on your chest, or you are wearing that same clothes that you've worn when he left. That is what you are wearing. Your hair is looking as if you are selling pepper on the street, but when somebody is coming in your house, you are going to shower, do your everything and look good for the person. You know, the person you should be looking good for is in your house, not those people coming in. You understand? There's a way you will dress, there's a way you will package yourself. Your husband cannot even pass without touching some part of your body. There's no way he can close eye, because it's a visual something. That is how God created them. What they see is what they do. It's not that you go and tell him, you know I'm beautiful. No, it is not you. He needs to see that you are appealing to touch. So that is why sometimes it's not just because of your man, or because of the timing or everything. Aside from the phone thing, or from you not having time, you need to make yourself look good as well and smell good. Some people don't even shave all these places that are there, even down there too sef, e be like bush. If e be like bush, make sure say you trim it, you cut it. There's a way. Yes, now some people will not tie it that way. I know the way you are talking about Elvis, but some people will just wrap it around their chest. It is not nice. So make sure you look good when it comes to you appealing your man. Thank you for your service, Nicholas. Mr. Nicholas, thank you.
Indeed.
So I will say that those, especially African, like you said, West. Abi? Yes, West.
West is in the European.
He's talking about Europe abroad.
Ah, English, oh, hey, English finish me today. Okay, in that aspect, I think the only problem we have is timing, and because of our jobs, that is the only thing I can think of in that aspect. But I think most people still work it out by, getting a schedule that works for both of them together. Maybe in your workspace or wherever you're working, you both can come together to like try to arrange your off days. Some people make use of timetable. I don't like that one. It's not something that I like, because like I said, you don't know when the opportunity will come. That is why all this spicing up of your thing is important, because you don't have to wait for the perfect time. In fact, research has shown that, you see, the least planned intercourse is the sweetest, the one that women enjoy most. Women don't need you to lay bed or to do everything. No, just hold her in the kitchen and tell her to pick one or two things on the one. Anyway.
That's a good tip.
That's a good tip. Mhm.
Yes, seriously, you don't need to do too much. Just do with the flow, and all these things is just you not wasting time and doing things on time. Because I know that some men, because of that timing and because of the phone and everything like that, they see it like, let's just do it maybe once a week and everything is good. No. If you are the type that, okay, you are lucky that you are not doing alternate work, maybe your wife is doing night and you are doing day. If you are both sleeping in the same house, there's nothing stopping you guys from having a session in the middle of the night. Sometimes you stay awake gisting, you stay awake pressing phone. Yeah, but men are carried away by pressure of, like, what is the part of women in terms of preparation? Hmm. Pressure of life. I think pressure of life is everywhere on everybody, and this is one of
Not
the
even just
ways.
women. Women are facing the pressures
Of
of
life also.
Exactly.
As you wake up in the morning going to work, the women are waking up in the morning and
I'm
going to
going to
work.
work as well. So the
Mhm.
pressure is everywhere. I believe it's everywhere. It's just that, in
I
fact, this is something we should do, because this is one of the ways of escaping the pressure of life. Because at
Vala.
that point in time, you are not even thinking of what is going on in the environment. And that is why I said, in relationship, you should communicate. You should not be with somebody you can't talk to. Maybe the pressure is due to financial pressure or whatever thing it is. Sometimes when you share your emotions, you feel better about it. And There's no way when you are with somebody that you both love each other, you are explaining to him, he's rubbing your head, putting your head on the breast and doing all those things. Come on, you go forget that. No be man. You will forget. For that 15 minutes, 30 minutes, you will forget that thing. And when you said preparation for women, uh I think it's only women that is difficult though, because psychologically it's women that have the problem of not being ready. But for men, once you, in fact, if you just touch like this, they will think you are ready. That is it. So I think the only
Then
thing is,
just continue. I'm coming. Continue.
okay, I feel the only thing is, if a woman is like, all this pepper body, or like you are the type that you get angry easily, or like you don't listen, you don't give a listen here to your partner. I think this can affect that as well, because sometimes men just need you to acknowledge that this is what they've said, and that you're going to do something about it if you can, if you have something that you want to do about it. But some women, they don't even want to listen, or they claim they are listening, but they're actually doing other things. So I think the only thing that women, one of the things, not only, actually there are other things, but one of the things women can do is to make sure that they give their partner a listening ear, and make sure that they're always there for him to rest, is held on his shoulder, like, ironically, just to be there to listen, to support him. Because in this part of this world, if plenty, oh, please, can this live section be rewatched, because some of our partners that are not here now need to listen directly by themselves. Yeah, so share them. I think, yes, you can rewatch it later, right, Mama?
What? Yes, they can watch it later.
Yes, she's asking that their partner, probably they need to rewatch it later, that they are not here to listen.
They can watch it. It's always on the live. It's not. It's still on the platform. They can always rewatch.
Yes. So those are the things I think women can actually do. And all this their pepper body, they should reduce it. I know, see, it's hard though. We know it's hard, but
Mm.
we
And you're
just need to
talking about
survive.
Igbo's
So to answer what you said about Evo's question, talking about life's pressure, that life's pressure, it faces both the man and the woman. But the thing is, we also know that when we these pressures outside, we only get our comfort then inside our home. So it's very important we build our home. We have a solid and strong foundation inside, so that when these life pressures are overshadowing us, then we can lean on the love that we are getting inside our home. So that one is also very important. No matter the pressures of life, we don't have to neglect our homes. We have to look for, that is why you say we have to look for things, change things, do things, not everything doing the same thing. So we just try to renew or rebrand ourselves,
Yep.
rebrand our styles of making love. Then I want to believe it's going to add a little bit of spices into that love relationship also.
Mm.
Mhm.
Yeah, I am blessed watching with my
hobby.
hobby. Hobby. Okay. So I don't know if anyone has a question. You can leave your question in the comment section now. Let's have a
Yes.
If
chat.
you have any question now, ask
Ask next blessing. Ask the sexual health
And
specialist.
yes, any question
Anything.
at all. Don't be shy. Just write
No.
it there. Me, I know they shy. I can talk anything. Don't worry. Write
Yes.
it there.
If you have any problem, if it's not going well, whether you are a man or a woman, if you are having dryness down there, if you are having
Yep.
this erectile problem, you don't know how to stay, if you are a 2 minute man,
Yes.
discuss it so that she can assist you and tell you what to do best, because she's in the best position to help you with this topic.
Yep. 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 Yep.
And
Let's
for
go.
more information, also don't forget to subscribe on our YouTube channel. That is the channel link pinned there. Just click on it and you are subscribed to our channel, so that you can always go back and learn the techniques and learn the strategies on how to better your sexual life, because it is very, very important in a marriage also, or in a relationship for those who are not married. But to recap, why they are struggling with their questions, to recap, I will just try to do a recap on what you've talked about. You've talked about the natural ways with foods that they can help to um, um, how can I, which word can I use to improve your sexual anxieties? You talked about them eating watermelon. You talked about the locust beans. So locust beans is very important. You
So yeah.
beetroot. Beetroot is something that is also good for people who are having erectile dysfunction problem. Beetroot is very good. Beetroot, it contains nitrates, which can help to relax your muscles also. You have things like garlic and ginger. Elvis mentioned about garlic and ginger, that is one thing that is going to improve your blood circulation. Tiger nut. Tiger nuts are very good. They are rich in healthy fats and they can help also to improve the sperms and boost your libido. So for people who are familiar with tiger nuts, you can eat tiger nuts. We have bitter cola. Most of us Africans, we are familiar with bitter cola. Bitter cola is something that is
Yeah.
also good when it comes to sexual sex because it stimulates, it boosts you up for your sexual anxiety. So bitter cola is something that is also good. It helps also in the blood circulation. For herbs, when we are talking about herbs, we have things like moringa tea, either the leaves or the seeds. They are very instrumental when it comes to erectile dysfunction. Those are all natural products that you can use them to improve your sexual life. You have fenugreek tea, you can drink it. You have cloves, you have cinnamons. Those are all natural products that can help to stimulate and improve your blood flow for anyone who is struggling with low libido or erectile dysfunction. So take note of those natural spices. Most of us, we already have these spices in our homes. We have these foods in our homes. We are not just familiar to them, or we don't just know that these are the kind of foods that we are supposed to be consuming that is going to help us in these problems. Yes, they are going to help us in these problems, but note that these are all natural products, and natural products, they normally takes time. It's not like an injection that you will inject yourself and it will go directly into your veins. No, natural products, they takes time, so give them time. Be consistent, and know that they are definitely going to help you in your process. They are not quick fixes. They are not something that you will take and then within 2 weeks you are expecting to see results. No, do it, be consistent, and I believe you in the long run you are going to see results. We have foods like, well, fruits or vegetables like avocados. Avocados are very vital. They contain healthy fats that are also important. Our palm kernels, I don't know if we know palm kernels. Palm kernel is something that is also very vital. I'm not talking about the palm nut, the red one. No. When we crack the red one open, then we have the kernels. So the kernels, they are also good for erectile dysfunction or for people who are struggling with low libido. Granite, sesame seeds, all those things, they are very instrumental. So those are all natural products that we can be consuming in the place of us rushing to the hospital looking for quick fixes. No, includes all these vegetables, these fruits, these spices, add them into your food for better results and be consistent. Keep on doing it, and along the line, you will definitely see some changes in your life. And if you cannot see changes, if you need somebody to talk to, because some people also mentally they are also affected. If you know that your mental health is not stable, it will be very difficult. Just like our nurse talked about it, if your mental health is not stable, it is going to be very difficult for you to attain an erection. So make sure to work on your stress level. If you are emotionally stressed up, make sure to work on it. Look for someone that you can talk to, even if it is to go in for a therapist. Go for therapist. Talk to your community. Build a solid community, people that you can trust, people that you can talk to them. Just by you talking to them, you can release yourself from some stress, which is also going to help you in your sexual life. So these are things that are.
Hmm. I think our network is bad. Can you hear me? So I can answer these questions we have here in the chat box.
Mhm.
Mama, you are back. Okay.
I'm back. Yes.
Yes, I
Mhm.
was just saying that we have some questions here. Can I go ahead to
You
answer
can
them?
go ahead.
Okay, so we've got Marvel G. She said solution to the issue of dryness, please. One thing you need to know with vaginal dryness is that depending on the cause, because sometimes it could be that it's just the normal one that there's really no underlying causes. While sometimes it could be as a result of menopause, because there are some women that they've arrived at menopause or they're on the way to go to menopause, and because of this it affects the normal hormones in their body. So this type of people now, they need to go for hormonal therapy. Those are the things that can help them, while some people they prescribe some lubricants, like KY jelly. Some of them could be water based, could be oil based, because at this point I'm not sure you'll be trying a baby or something, so it could be any lubricant at all. But the natural one, let's say, is just you being young, you're not going through menopause, or you're not close to going to menopause. It could be dehydration. Yes, most people they overlook this thing because they feel like water, how does it affect? Yes, it does. The same way when you don't drink water and when you wee, you're seeing that your urine is very concentrated. Is the same way you affect. If you don't know, there's a particular part in your body as well that secretes fluids when you're supposed to be in the mode. The Skinner's gland, yes, it secretes these things. But if you do not drink enough, there's no way this thing can function the way it is. Like a foil in the car. If you don't have a foil in your car, a petrol,
You cannot drive.
your car will not drive no matter how much you try to. Why some of you, you actually have petrol in your car, but you are not touching it the way you are supposed to touch it. Yes, like I said, some of you skip foreplay totally. You just go bam inside it. No, don't do that. Take your time, explore her body. Tell your man to touch me here, do this. You both can talk together. Let your body be explored. That is when you will know what exactly make you feel like wanting to be with your man. That is what exactly will make you feel like, oh, this is why I want to make love. Because at this point, if that part of your body is being touched, you will feel it, you will be wet naturally. So I hope this helps with that question. Some homes are very culture and sex is very organized. Remember the children are involved. What is your intake about that? Um I'm not, I've always be against organized sex, because are you saying that, let's say we've agreed to have intercourse on Tuesday, and today is Monday, I'm in the mood, I'll have to wait till Tuesday. I can't do that. We need to have it whenever, wherever. You are in the mood, you put me in the mood, we have it. I'm in the mood, I put you in the mood, we have it. Yes, there are children. But also remember, without you both, the children will still be good. And a time is coming, the children will move out. It is you and your partner that will be left in the home. So this is the time for you to create the bond, to create, that relationship that you guys both have. That is why I said you can actually either take them to be with someone. I know in this part of the country where we are, it's difficult for you to get someone to look after your children, but there's no way. Sometimes you will get away. They sleep at night, don't they? Them witch, they are not witch now. So you just, it's a timing thing. Like I said, intentionality. You choose to do it because you know it is going to keep you guys together. um I have a has been complaining about her breast, and she has been to hospital in Belgium and Holland and in Cameroon before, but they see nothing. What is her complaint, and are you sure she's being examined? Because we have some people that they deal specifically with this part of the body, like the gynecologists. They deal with all these reproductive organs in the body, and the breast is not exempted. So are you sure she's seen people like that? Because sometimes when you go to the hospital and you just see a general doctor, it's just like you are coming to me now to ask me about diabetes. I will tell you a basic knowledge, because I did not study diabetes. I only study, both of us, we only studied nursing, but everyone choose which part of that nursing you want to focus on, which part of health do I like most. So are you sure she's seeing the right people, Elvis? Um,
Njideka says, please, does prostate lead to erectile dysfunction?
yes, it does. You know, when it comes to prostate, well, let me get your question. Prostate is an organ. Do you mean prostate enlargement or benign prostate enlargement? Is that what you mean in Njideka? If that is what you mean, yes. Because what happened with benign prostate is that the size increased. And remember, there's ureter, there's urethra. So ureter is in the bladder, but urethra is the one that comes out. And that is where your urine, your ejaculation, those are the places it passes through. Now, when there is benign prostate enlargement, it means that, yes, I've done when there's prostate enlargement, it means that the prostate
Blocked.
is swollen. That is what it means. It means that it is swollen, and sometimes it affects a lot of things, like even the passage of urine. You will see that you go to wee a lot, but it's not coming the way it's supposed to come. Yes, okay, yes, I get your point. And now, when this happen, you go to the hospital, they give you medication. Most times, the medication you are having, the side effects can worsen erectile
Erectile.
dysfunction. Yes, it can worsen
and,
erectile.
and that is also the problem with diabetes, because most of the diabetes medications that they are taking, people they have side effects also with erectile dysfunction. So sometimes people they get all these problems because of the medications that they are taking.
Yeah.
Yes.
So that is why you should approach it with diet and lifestyle. Also, let's put aside the medication for this what is it called, for this prostate enlargement. Some men naturally, maybe because of that swelling, because of whatnot, there is going to be like a blockage of blood supply. Remember, your prostate, your bladder, all these things, they are connected. And sometimes the blood vessels that carries blood to your prostate might be the same or might be connected somehow to the one that is going to your penis. So there is going to be reduction of blood. See, anything swelling, it means the normal function of that place, be it nerves, be it blood vessel, it will reduce. Because it's just like I'm in a space and then you are squeezing me like this. There's no way the blood will pass freely. And remember what I said, without blood supply, there is no erection. Uh yes, sir, they have done an MRI twice. What is the problem exactly? It's still in the hospital that you can get proper equipment to test her, to check if everything is going on. I can't really say anything because I don't know how what she's going
That
through.
one they should, you should see the doctor. If they can do
Yes,
an MRI and they cannot see anything from the MRI, then it's best to go to the hospital for the consultation. We don't diagnose. We cannot
no,
diagnose.
no, no. We only teach you how to prevent things.
That's
And
it.
also, yes, we only teach you how to prevent. And if you have any question at all and any advice, that is why we are here. So, are you saying that a human body was made to have sex anytime and anywhere? Is that what you're? Yes, that is what I'm telling you. Anywhere, I'm going to use the F word. Anywhere, anytime, whenever, wherever. And this is because, let me tell you, your body naturally, it is meant for you to be readily available. That is why your man or you as a lady needs to know where to touch. When you know where to touch, it's like you are unlocking or you are starting your car. If you I don't know your car now, and I'm in your car, I'm just turning the steering wheel, I'm turning, the car will not go, it will be there. But you are the owner of the car, so you came immediately, you put the key, one time e go answer you because you are the owner of the thing. So that is why you should know where to touch, what to do that will make your woman to be. It can happen anywhere. Sometimes we do watch them in the TV, but it's happen in real life. It is when you are lacking, maybe you and your partner choose not to explore. We have people that, yes, the children are inside, they are eating, they are watching TV, or maybe they have an elderly one that can be with them. You and your partner could have one or two sessions in the garage, one or two sessions in your car. You can be in your car and lock your car inward if you have a tinted one. You can also, just visit somewhere and have a quickie. That is what we call a quickie. You can do it within. It is not the one that you have all the step in the word. No, you just go straight into action after touching the places that you know that it will put her in the mood. So yes, Mr. Ivo Bekono. No, we are not. We are not. But this is just for us that we are in an environment whereby it is hard for us to, meet up because of timing, schedule, and everything like that. What I'm trying to say is for us to bond, is for the purpose of bonding and maintaining the relationship. It's not,
Yes, I
yes, it's,
think the message you are even trying to pass, like the main focus is that we don't only have to have sex on the bed.
yes,
Sometimes anywhere we can do it. You are just saying that we don't have to like program it that it
yes.
must be on the bed or it must be on this particular day. No, the issue is you can have it anywhere. I believe that is the message you are trying to pass also.
Elvis, it depends. Some women know how to use the joystick well, while some people don't. If you are not sure of her ability, that is when you should not allow her, because, like I said, it could lead to penile
Hi
fractures.
Dora.
It could lead to penile fracture. But if you know that she's good with what, do you know that some women, they don't even actually enjoy other, styles except from reverse cowgirl, which involves her sitting on
Hi
it
Virginia, you're welcome.
which involves her sitting on it. So it depends on the person using it. That's why I said not the person using it, and be sure that you are cautious as well. Virginia, you are welcome.
Yeah.
Hmm.
I believe we have touched almost every point. If there are no questions, I don't know, maybe you have one word again for us. We've taken more than 2 hours, I believe.
Yes, yeah, I think so. I don't even know what the time is. What's the time?
Do we have any questions?
Okay,
Any
well,
questions about?
exact. Yes, almost all
Yes.
women enjoy it. Yes, because it touches the most important places without pain. Not everybody will break it, Elvis. Have you had your own broken before? Virginia, you can rewatch the live. It will be on our page. When you click on the live, you can watch from the beginning.
Yes.
Do you want me to do my final words or we wait for each
Yes,
one?
maybe you can give your final word because you've talked about everything. You've discussed what erectile dysfunction is. You've talked about the food that they can eat. You've talked about the lifestyle. You even went as far as showing some techniques or discussing some techniques that we can use. So maybe if you can give your last word for us, and then we can round the show off because we've taken a little bit of time, even though it was good, it was interactive and
Yeah.
good explained because you've explained everything so detailed. So thank you very much.
Yeah. Okay. So I think most time when what I say to people is that play hard but stay safe always, because if you're not safe, there's no way you can play at all. So your health is very, very much important. So it is good to have fun, but make sure that you're safe as well. Protect yourself if you're unsure of the person you're with. And if you are unmarried, please ensure to make sure that you have proper checks up done before you go into any woman at all. Don't say, oh, she looks pretty, she looks healthy. No, she could look, she might look, healthy, but she might not be healthy internally. So it is good to always check. Amen. A diabetic and I have a low libido. I'm late. Please, a small thing.
No.
Hear me now?
Yes, I can hear you now. It's good.
Okay. Yeah. Sorry, I had the call. Dora, we've talked about it. I think some minutes ago. You can watch it on the live, but basically, what you can, I think you are a lady, if I'm not mistaken. Are you, Dora Tete? Are you a lady? Are you a woman? Anyways, I'll continue the final words. Let's wait for our answer. Okay, yes. It depends actually on what you can do, because sometimes it could be that you probably you're approaching menopause, or like you're already in menopause. If that is the case, then you will need to go through what is it called? The use of lubricants, which it
Ness,
could.
your camera is gone. We are not seeing you.
Oh my goodness. Can you see us now? No, 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 no. Can you see me now?
No.
But you can hear my voice. I don't know why it's like this.
Yes,
Should
we
I,
can hear you. No problem. We can hear.
yeah, should I continue talking, or
Yeah, if the camera is not going there, you can keep it like that. No problem.
okay. So, Dora, as I was saying, you can make use of, okay, first. Oh yeah, I understand now. Okay, so the only thing you can, or sorry, the things you can do is to hydrate more. We mentioned some fruits that can actually help you, but we said in moderation because of your diabetic, what's it called, diagnosis, and that is why you need to rewatch the life, because we really talk about a lot when it comes to libido, hormones, and everything like that. So, Dora, hydration will help you, and because you are 40, probably you might be moving closer to menopause, or because of one or two underlying diagnoses that you are not sure of, you can make use of lubricants. It could be water based, it could be oil based, but it is worth checking with your doctor as well, especially your gynecologist. So you could have one or two sessions with her. It could be test, it could be anything, because sometimes infection can reduce your libido as well, because this thing can affect you mentally. And also, when you have low libido, your hormones is very, very important. When I was talking about lubricants, I'm saying that because, I'm sorry I didn't mention why I said lubricant. I said that because some women think they have low libido, but they don't. They are the one actually running away from the intercourse because of the probably the past experience of experiencing pain or whatnot. But if it is not due to all these little things, it could worth you checking your hormone. It might be worth you checking your hormones, because there are some hormones in the body that needs to be balanced, like the estrogen, like the testosterone. Even though the testosterone is a smaller amount, it is also important, because those are the things that make you feel alive, that make you feel like, oh, I want to have sexual intercourse. I hope you understand, Dora. So you can try to check your what's it called, your hormone level as well. We've also mentioned some fruits that can help with your libido. So you can rewatch the live if you don't mind. So as I was
Yes.
saying, yeah, as I was saying, always play safe and stay healthy. Stay healthy by doing some exercise, eating healthily. Like we've mentioned that sometimes Elizabeth Afron, libido is in a simple time is just when you feel like you want to have intercourse with your partner. Now, low libido means you don't have that urge. It's like a urge that needs to come from your body.
That desire is not there.
Yes, yes, that's the meaning. That's the meaning of libido. So as I was saying, stay healthy, do some light exercise like walking. You don't need to do all these big ones. So do some light exercise, and most importantly, watch what you eat, and also your regular checkup. Don't forget to do that. So Diabetic Talk Mama has already I think sent the link to my channel. So if you want more on these things, I have made a lot of videos on libido, on erection, a lot on my channel when it comes to sexual health. So you can go there to watch it. And yeah, if you have any issues as well, I also do one-to-one consultation. I have my information on my channel, so if you go there, you see everything there. So yeah, Mama.
Okay, nice blessing. Thank you very much for that elaborate explanation. You've talked everything, almost everything about erectile dysfunction and low libido, how we can better it, how we can manage it. So we want to say thank you very much, and we hope this will not be the last time you are still going to come on here to talk
No,
about other
no,
things, because as
I
times goes, there's also evolution. Things are evoluting. So we hope to see you again next time, so you come up with other things or other techniques to educate us here, because diabetes, we need to manage it and we need to maintain it also. So it is not something that this education will have it just for one day. No, we have to follow up also. Just like when we have
yeah,
our patients, we don't just treat them and we allow them to go.
to
No,
go
we keep on following them so that they don't go out of this treatment, or they don't fall out of this
of
treatment.
the
So we hope
treatment.
to see
Yeah.
you again, and we say thank you very much. For those of you who are interested in knowing much about sexual life, sexual performance, styles on how to sex, please check out on her channel. Her channel link is being pinned on my channel. That is her channel link pinned there. Subscribe there, go to her channel and watch her videos. She has so many videos on sexual intercourse, the kind of fruits that you should eat, the techniques that you can use at home. So please subscribe to our channel, and we are definitely going to see her again on this channel, because she is going to come back to educate us again about sexual intercourse. So we say thank you very much, Nurse Blessing. It was a privilege having you here, and I want to believe that we have learned a lot from your show today. So we say thank you very much. Thank you, ma. Thank you.
Thank you for having me, and I'll see you next time. Bye bye.
Bye bye. Have a nice evening. Bye, and
Thank
enjoy your holiday. And before I forgot, I want to appreciate you
you.
also, because it's not easy. You are on holiday, but yet you took your time to spend this couple of hours with us. I say thank you very much for sacrificing these hours to us. So we really appreciate you. Thank you.
Thank you too. Bye bye.
Bye.
Yeah.
Voila. So, hi, diabetes mindful people. You all have heard, you've learned from our nurse Blessings. She is a sexual specialist. So, if you have any problems about your sexual life, please make sure to go to her channel. She has very educative channels there. Go there, subscribe to her channel, and learn more. And know that diabetes is something that we can manage naturally. And just like we can manage it naturally, we can also manage and maintain erectile dysfunction naturally, just by using the tips that she has given unto us. The tips when it concerns your food, your feeding, the foods she said you should avoid sugary food, avoid foods that are high in carbohydrate. If you're smoking, avoid or stop smoking if it is possible, because smoking, it destroys your nerves, it damages your blood vessels. If you can limit your alcohol, if you know that you cannot just stop alcohol, limit your alcohol intake. It's going to help you also when it comes to erectile dysfunction. She talked also about your lifestyle, eating healthy, exercises, and the techniques that she gave us. So let us all try to incorporate these techniques or these lifestyles into our lifestyles, and definitely we are going to see some changes when it comes to our sexual life. So thank you very much, and know that erectile dysfunction or low libido, it is not your destiny. With the right information, just like the information that you have gotten from this channel today, with this information and the right mindset, you are going to conquer it. But give it a time. Give it a Elizabeth say, where is her channel? I pinned, you see the yellow link, like Diabetes Mindful Talk, the yellow link. There is a website there. That is her channel link. Just click on it and subscribe to her channel. Madam Elizabeth, the link that is on the screen, that is her channel link. You can just click on it and subscribe to it. If not, you can just type on the search bar, type on Blessing. She was Blessing on Demand. Yes, click on the search bar, type on Blessing on Demand. You can subscribe to her channel, Blessing on Demand. That is her channel's name. So you can subscribe to her for your diabetes talk. Yes, just click and subscribe. So thank you all very much. I believe that we have all learned If there are no questions again, then we are going to call it off for today. And next week, Friday, we are going to continue with our reverse diabetes with African meals. So today was also a continuation of it because we talked mostly about African foods that we can be eating. But next week, we are going to shift from erectile dysfunction and low libido. We are going to concentrate on our blood sugar levels, how we can manage them using our natural food. So thank you all very much for being here. I really appreciate your presence. Madam Elizabeth, I say thank you. Pastor Elias, thank you for joining. Njideka, thank you. Olayinka, thank you. Virginia, thank you for joining. Elvis, thank you very much. Dora, Madam Dora, Carl, I see you all. Thank you very much. Quincy, I see you all. Thank you all very much for your support. Thank you all for your time. If there are no questions, then we will call it off for today. And hopefully we are going to meet next week, Friday, same time at 8 p.m. So I'm wishing you all a pleasant weekend ahead. God bless you all. And remember, diabetes is not a race. It is not a race. It is a step, one step after the other. It is not how far. No, it is how far you can go, not how fast. Take it slowly, but steady, and then you are going to achieve your goal. And remember, every little step, every little changes that you make, they count. Even if you are not seeing them physically, they are having an impact on your blood sugar level. So stay connected, and thank you all very much. We catch next week. Thank you so much, ma. I will rewatch. Yes, Madam Evelyn, you can always rewatch. The videos are going to stay on our channel. It is not like the other platforms that the videos they disappear. Live on YouTube, the videos remains on the platform, so you can always rewatch them. Thank you all very much. I see you. We have our balance. Before we go, we have our balance and our Unimate. If you need the products, please do not forget to send me an email on how to get them so that I can send you the link for you to order them. For those of you who also need a one-on-one consultation, don't forget to send me an email on diabetesmindfultalks@gmail.com. Have a wonderful evening, and we'll see you next week. Bye.